Do you have any thoughts on like laser eye surgery and when it's appropriate to do that, or if it should be done at all?
Well, I think laser eye surgery is one of those things that I treat with a little bit more caution, just because my perspective on it is that if you're going to correct your eyesight, I like it to be something that's adaptable, because our prescriptions change throughout our lives. It's always going to be slightly different. So I have patients quite often, you recommend for younger people every year or two that they come in, you see them after 2 years. And in most cases, their prescription has changed by half diopter. 10 years down the road, most people who have LASIK or PRK, a similar type of surgery, most people have to either wear glasses or get some kind of a touch-up to that surgery. I don't view it, generally speaking, as the longest-term solution, but for certain things, it's a great choice, because if you've got somebody that has such a severe prescription that they can't even really get out of bed without putting their glasses on or putting their contacts in, that often impacts their lives. Where for those of us with a smaller prescription where it doesn't really matter, you can walk around just fine without your glasses, it doesn't tend to be as good of a choice for those people. But if you've got someone that is a -6 in prescription, has trouble getting out of bed in the morning without wearing their glasses, they often are very, very happy with the LASIK, so that I tend to encourage it a lot more for that type of patient. And as well, age matters for this, because if you've got somebody that's in their 20s, they're a great candidate quite often for LASIK, so long as their eye parameters, like their cornea is thick enough, all that kind of stuff. So long as that is intact, they're often really good candidates for it. But somebody who is, say, 50, we go through this normal change, throughout our 40s to our 50s, basically, called presbyopia, and it's where we start losing our near vision. It's related to changes in the lens in our eye. Once you start going through that change, LASIK itself doesn't end up being as good of a choice either, because then you can only correct your vision to one distance. So either you have really good distance vision or you have really good near vision, and you need glasses for the other thing. So people that have LASIK at that point don't tend to be as happy with it, just because they still have to wear glasses. So why not wear it for both reasons, kind of?
Is there a maximum number of times that you can have that done to your eye before it's no longer either effective or you're not physically able to do it anymore because the eye is not able to support it any longer?
Yes, definitely. It depends on the person, because we all have different corneal thicknesses. So if you've got a thicker cornea, let's say, and you had a lower prescription to begin with, because what LASIK does is typically it's for nearsighted people. That's usually what it is. So nearsightedness, myopia, is what it corrects the best, the most effectively. So what you're doing is you're flattening out the cornea by using this procedure. So because you're flattening out the cornea in steps, you rely on a certain thickness of that cornea. And you need to leave a certain amount of thickness in order for the eye to stay healthy and everything like that. The limitation is definitely there, but it depends on the person. I think generally speaking, they only do one touch-up, but it depends on the surgeon as well,